Good afternoon. I'd like to call the Health and Human Services and Aging Committee meeting together Wednesday, March 8th, currently 1:15. Madam Clerk, can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll for Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens.
Present.
Ms. Turner.
Present.
Mr. Miller.
Present.
You have a quorum.
All right, thank you. Anyone signed in for public comment, Madam Clerk?
Yes, Madam Chair, we have one person signed in for public comment. Lou.
Welcome, Ms. Lou.
Good afternoon, everybody. Don't miss me. I'm right here. I definitely am here to support the two resolutions we have today. It's very important for us to invest, not just provide the minimum fundings to support any of the health and human services. Homeless shelter, the situation has been the proof. When you have neglected the investment for decades, guess what happened? People get stuck in the wrong kind of building without a possible way to get out of it, because right now, even with ARPA funds, it seems like we still don't have any decision to change the plan instead of just renovating the building. I'm talking about demolish the buildings to rebuild. Of course, insufficient funding, the accumulation also affects what kind of workforce you will have in these services. For example, this morning, again, I still had to get harassed by the workers in the shelter. They just do not let me lay down. But the whole places, how many beds you can actually have to serve all the people are actually in the facility? Not enough. In my situation, there's some kind of homeless politics involved in that situation. Yes, I've been sleeping on 3 chairs in that hallway since October 30th, 2022. So now guess what happened to me? The varicose veins got busted already, bleeding everywhere. I have to put that as a higher priority. But still, these workers do not care about these things. If they don't want you to sit here, they don't want you to lay down there, they pick and choose. They harass me, but I saw somebody just still sleeping even before I left the building, still sleeping by the lift, which is for wheelchair and walkers to go up and down. So the disinvestment on health and human services is real. Don't just look at today's resolution. We do have a $2 big amounts, but these amounts maybe look big right now since the county doesn't have a high revenue, but are they enough to compensate all the neglect from the past? Not enough. So we have to keep working on it. We do have to be wise to how we spend the money, taxpayers' dollars. Instead of supporting some of the projects, only supporting certain people, for example, downtown business, maybe we should remap how we allocate taxpayers' money wisely. Thank you very much.
Thank you. Any other comment?
That concludes our public comment, Madam Chair.
All right. Approval of the minutes from the February 22nd, 2023 meeting. Can I have a motion?
So moved.
Second.
Okay, it's been moved by Turner, seconded by Sweeney. All in favor, please say aye.
Aye.
All right. Matters referred to the committee today. We have 2 items, I do believe. If we could, Madam Clerk, read the first item into the record.
Resolution 2023-0048, authorizing an amendment to a master contract with various providers for community-based services to support at-risk children and families for the period April 1st, 2021 through December 31st, 2022, to extend the time period to December 31st, 2023, and for additional funds in the amount not to exceed $4,912,734.60.
Good afternoon, David Merriman on behalf of the Department of Health and Human Services. The matter before you, the master service agreement with the community-based service providers, is a really important service that DCFS, Division of Children and Family Services, has carried out for years. And in a second, Marcos Cortez and Jackie Fletcher are going to come forward and talk about this item. I do also want to acknowledge we continue to work with the providers, talking about changes to the program, changes to the way that we allocate funding, and ultimately how we improve services for our families. This item and the next item will be presented by Marcos, and then I actually will be stepping out for the second item. Thank you.
Good afternoon, Marcos Cortez with Health and Human Services on behalf of Division of Children and Family Services. This is the second amendment to a master agreement with various providers for the community-based services for at-risk children and families. These providers will deliver high-quality, innovative, and promising practice services to at-risk children, teens, and families in order that caregivers, birth parents, foster parents, and other kinship caregivers can provide a safe, stable, and nurturing environment for children and youth. The overarching goal of this service is to help parents enhance skills and resolve problems to prevent entry into the child welfare system and to lessen the time in the system for those already involved. Knowing that families can benefit from support in some ways, the range of family support that can be incorporated into community work across a service continuum. We have Interim Director Jackie Fletcher here and Joe Jackson, who can answer any specific questions about the contract program itself.
Any contractual questions? All right. Councilman Sweeney.
Thank you, Madam Chairwoman. Marquez, nice seeing you, as always. Just looking at the 1 through 9, I just don't know, the Lakewood, it seems like everything else is an entity. Can you tell me what the city of Lakewood, how does it interact with this one? Because I know what Catholic Charity does. I know what East End and Harvard and Merce Taylor. But does the city of Lakewood have its own standalone?
Yeah, there is a council of neighborhood leaders, which, these entities are leading their specific collaborative areas. City of Lakewood leads their specific collaborative area. They do have, I believe, a Health and Human Services department within Lakewood. So they are part of that group. They provide the similar services that all the other agencies provide as well.
Thank you. And I was just curious, other municipalities that have social services, they don't ask for this?
So we do issue an RFP for these services, and my understanding is Lakewood is the only one that has been part of that RFP, that responded to that RFP in the past. I would have to look.
Oh, no, you're good. That gets me totally clarified. And an RFP went out, and they just chose to be proactive, and I can commend them for wanting to help. So thank you, Madam Chairwoman. My question has been answered.
Councilman.
Madam Chair, Director, does each of the agencies have a specific service area so that when you put all 9 of them together, it covers the whole county?
I'm going to ask either Joe or Jackie to provide additional information. My understanding from the past that there were geo areas that these collaboratives covered. So, they would, their Lake would be a west side one. There's also, closer to the middle of Cleveland would be West Side Community House. But my understanding is that their reach would be county-wide with these 9 different community collaboratives.
And does each one provide the same set of services, or does it vary?
That I will have to ask for Joe or Jackie to confirm.
Quickly answer your question. Each one provides their,
Mr. Jackson, can you state your name for the record?
I'm sorry,
please?
Joe Jackson, Interim Deputy Director at CCDCFS.
Is your microphone on?
Yes, sir.
Okay.
All right. So to answer your question, each collaborative provides all of the deliverables that we require, but each also has their own unique services. So they do vary.
And if someone lived in an area where they could conceivably be served by maybe 2 or 3 different of these agencies, how do people get linked up with service providers?
One of the great parts about the collaboratives is that they work together. And so if there is a shared zip code, which we have a couple, the collaborative would find out which one is best fit for that particular family, and they would send them to that particular collaborative.
And so how are families that need these services identified and connected up with agencies?
Both from internal referrals through our agency and external referrals. So the collaboratives, they provide advertisement within their own communities. And so many of them, they know their communities, they're connected with the many resources within their communities. And that allows for people to be referred, whether it be through the hospitals, the schools, or in different various other entities. Churches can always refer their clientele to the collaboratives. And then internally, as an agency, we make referrals based on the needs of our families to the collaboratives.
Okay, thank you.
All right, hearing none. So I just wanted to say, this is probably a legislation that I've probably written to each of the committee members about in regards to what's going on behind the scenes. So there's been a lot of meetings in regards to this particular contract. So where we stand to date, I would ask my colleagues to pass this to the full body under second reading suspension. But in saying that, there will possibly be an amendment that will come shortly after to extend the time period. And the reason being for the extension of the time period, I've learned a whole lot about M4 that I probably didn't want to know. So the extension to the time period is because the way this contract is written and the dates that it starts and ends presents a problem in regards to prompt payments to our community partners. So we are taking a look at that. And so my ask would be that we're also looking at equitable funding model with this particular contract, payment of invoices to our community partners on time. We've had a specific meeting that I invited each of you to if you had wanted to come, and external sources, because we refer internally to the collabs, but they're also getting referrals from hospitals and all that, and I don't think it's an equitable system in how we're paying them. Another issue with this was at the end of the year, so the reality is these collabs will not be able to, once we pass as a council as a whole, this contract, we will not be able to pay the providers for their January and February invoices until probably April. And that, you know, with some of these being small agencies, that is very hard to take a look at and fathom, but that's the reality, the way this contract date is written. So that is one of the main reasons that we'll come back with an amendment to extend the time period. So in January and February of 2024, this will not occur to them again, and hopefully they and the community will survive. So I invited, if I could invite Walter up to give us a little brief presentation on decertifications of funds. So as every year, at the end of the year, the county must decertify funds. And so Walter's going to share that with us, and how, if I was a little bit more knowledgeable, we could have probably extended last year's contract so we could have assisted the community partners with this January and February, but that did not happen. So I'll turn it over to Walter.
Okay, so Walter Parfiowitz, I'm from the Budget Office. Similar to what I presented at the results of operations, each year we have to decertify unnecessary appropriations off the books just for audit compliance until we receive a new certificate of resources from our Budget Commission. The decertifications really have no impacts on the contracts. The contracts are when they're put together for a very specific time with very specific funding. At the end of the year, when we decertify a contract, the very next year, just as long as the contract is still in force, we can recertify that same amount of money. So money is not lost through these processes. I just want to be clear on that.
Okay.
It's a very simple process. Just our office is required, or through the fiscal office, we're the ones who certify amounts on contracts and decertify amounts on contracts, all at the department's request. We can do it within minutes each day if we just receive the request. Not a difficult process at all.
Any questions for Walter?
You're welcome.
Thank you for sharing your time with us. Just also on that point, really had lengthy discussions and meetings in regards to the payment of invoices to community partners. And this is not just happening with this particular contract. It is happening to a lot of HHS agencies. It may even be happening to other departments within the county. So we had a meeting to talk about the various processes. And I know depending on where the funding comes from, that may change the process a little bit. And so in HHS, it was a very lengthy process. So we're trying to work through that, seeing how we can get our community partners paid a lot quicker, and not just on the onus of us. I will say that the community partners also agreed in terms to get their invoices in. So I just wanted to give you guys that update. Is there a motion to move this to the full council under second reading suspension?
So moved.
Second. Okay, moved by Stevens, seconded by Turner. All in favor, please say aye.
Aye.
You're welcome. Madam Clerk, can you read the next item into the record, please?
Resolution 2023-0049, making an award on requisition 9776 to the Metro Health System in the amount not to exceed $1,551,000 for comprehensive medical services for families involved with the Division of Children and Family Services for the period January 1st, 2023 through December 31st, 2023.
Good afternoon again. Marcos Cortez with Health and Human Services on behalf of Children and Family Services. Safety concerns are brought to the attention of DCFS 24/7. Youth in care at DCFS, we determined that the youth in care need a full access to trauma-informed medical services that can appropriately address the significant challenges that children and youth are faced with when being removed from their home or their placement. In order to pursue the safety, health, and well-being of children in custody, DCFS offers comprehensive medical services, including screening and assessment of health needs of children and youth, comprehensive post-placement physicals, and alcohol and drug testing for caregivers, youth, or other adults in the home. We issued an RFP for these services on May 31st of 2022, with proposals due on July 1st, 2022. We received one response, which was from Metro. Even though there was only one proposal, we did have two teams review to give us a better kind of overview of the proposal itself. We did receive a final recommendation from the department to award Metro in September. Negotiations with the vendor took place between October and November. However, we did run into specific contract and insurance language issues that had to be negotiated between our law department and Metro's counsel. We were able to finally submit the agreed upon contract on January 25th. We do have, again, interim director Jackie Fletcher here, along with David Greenspan and Dr. Lauren Gopel from Metro.
All right. Thank you and welcome for coming. Would any of you like to speak? I know you came out. Greenspan lives here, so it's okay. It's okay. He's always welcome. So I think I just had one question, and I think I ask this all the time. I do not know why it won't stick in my head. In terms of these are medical services, does that include dental and hearing, those outpatient, specialty?
I'll leave that to interim director Fletcher to answer.
I always forget that.
Jackie Fletcher, Interim Director, DCFS. Specific to your question, I don't believe it's comprehensive general medical care, and so should the need arise that those are services that need to be in place for a child, then those are referred. And so in general, so since 2013, 13 it is, I believe it is, we've been partnered with Metro Health to provide that medical home for kids in foster care through the county. And again, I think Marcos indicated that provides the triage services, so any follow-up appointments that the kids will need, any care coordination services, so coordinating any other medical services that kids may need, as well as any other trauma-based support. Just to give you an example of some of our 2022 data, I believe it is, we had over 1,700 triages, 491 30-day post-placement visits. Psychiatry supports were 341, which is huge for this population. Office visits, over 5,700 office visits occurred for kids. So it's a lot of activities happening in partnership, again, with Metro. And if there's anything else I'm missing, you guys are welcome to provide some additional context
So,
for.
Madam Chair,
Yes, Councilwoman.
I want to follow up on your lead there. Glasses, kids fall, break them.
But I meant eyes.
They need
yeah.
they need a new prescription. How do we take care of our children?
Hi, I'm Dr. Lauren Gopal. I'm the medical director of our foster care program. In terms of hearing and vision screenings are done at all of the post-placement exams, just like a normal well child exam. We also make sure that these kids are seen more frequently than the AAP recommends for children not in care. And then referral services such as glasses, dental, psychiatric services. If someone has a heart murmur, we send them to cardiology. So we do the comprehensive wraparound care. I like to think of it as everything in terms of their health and safety is on us, and we figure it out, and we figure a way to coordinate and make sure those appointments can be made.
Is that inclusive of dental?
So dental would be one of the services, and we're starting an initiative to also provide fluoride treatments in clinic. That's something we can do in our primary care clinic, and then refer out dental services.
Okay, so are they getting their teeth cleaned and things of that on it?
Teeth cleaned is the dental refer out service. So my nurse practitioners are all medical providers, which, you know, we can apply the fluoride in terms of preventive care. But any routine cleanings, cavities filled, those kinds of things are done by a dentist.
So depending on the type of placement, so if they're in a foster care, and when you say refer out, it's up to the foster parent to make that appointment?
We coordinate it with them. So we do the referral, we schedule the appointment, we make sure it's a location that's convenient for them. It's complete coordination of care regardless of whether they're physically in our foster clinic or it's, you know, with a different provider.
Any more follow-up, Councilwoman? All right.
Thank you.
Any other in regards to this contract? Anything else you would like to share, Director Fletcher, in regards to this?
Madam
Need a
Chair,
motion, Madam Chair?
I'd like to ask one question, if I
Yes,
could,
yes,
before we move
Councilman.
forward. And so, my question is, what determines when health care for one of these children, when is it our responsibility and when is it not our responsibility?
That's a great question. Again, we triage, when kids come into care, from the initial placement episode, we want to make sure that we understand what that child's needs are, their medical status, and that's the triage process. So that determines the care from there, as well as any placement moves, any updates that need to occur. Kids are getting routine medical care through Metro Health Services. If the caregiver decides, let's say we have a child placed with a relative, and that relative wants that child to have some different care provided in coordination with Metro Health, that caregiver we can make a referral to a specialist for services and care and updates. But typically it starts from the beginning. When that placement episode occurs, kids are being seen through the medical, the foster care clinic. I hope that answers your question.
So would it include all children who are either in county custody or in foster care?
Yes, all of our kids in care.
And then when it would end is if the child were to be reunified with their biological parents.
Okay.
Is usually our goal. Not always possible, but usually our goal.
Is that it, Councilman? Councilman, are you through?
Yes, ma'am.
Okay, how is is Metro paid for this contract? Is it a monthly invoice?
I actually don't recall, but it's usually probably usually monthly invoices. That's generally how we structure the contracts, all of our contracts.
Are we being on time with their payments, or are they behind?
I'd have to look back, but I don't believe our office pays those, so it would come out of specifically, I think DCFS would process.
So if we can get that answer for the committee, where is it paid from, and if they're on time with their payments?
If I may, obviously, this one is late as well. If we could get it passed on second reading suspension.
Yeah, I see the dates. Councilwoman Stevens, you were going to make a motion?
I so moved.
Second?
Moved by Stevens, seconded by Sweeney. All in favor, please say aye.
Aye.
Moving to the full council under second reading suspension. Thank you. Business, I think I had shared everything that I needed to update.